This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob and this is Medtalk, your weekly on-air health consultation here on the Solar News Channel.
Long, short, curly, or straight. Whatever your hair type, you're not exempted to at least one hair problem.
Maraming mga problema sa hair at sa scalp. Ang isa sa pinaka-common, yung nakakalbo, naminipis lang ang buhok. Meron yung naglalagas ang buhok. For the scalp, ang pinaka-common dyan, dandruff, mga scaling sa scalp, itching, yung iba, nagkaka-pimple sa ulo, tapos yung iba mga kuto naman.
The average adult head has about 100,000 to 150,000 hairs, and we lose about 100 strands a day. Yet, unusual and excessive hair fall may mean more than just a salon problem.
Alopecia is a general term. Parang ano yan, pagnipis ng buhok or pagkakalbo. So maraming causes yan. Dalawa ang major types yan eh. Yung isa, yung scarring alopecia. Yung scarring, pag nasisira na yung root ng hair, nasisira yung root, pag ganon, damage na yung follicle, wala na. Hindi na mag-grow. Meron naman yung non-scarring, yan yung mas common. Yung non-scarring, ibig sabihin, the hair will still grow. Pero iba-iba pa rin yung klase yan. Meron yung patchy lang ng thinning hair or talagang totally bald. Pwede pati kilay, matanggal, lahat. Matanggal, all body hair.
Alopecia is a rare ailment being experienced by 1 out of 100 people in the world. It can also be attributed to a number of triggering factors.
May gene sila na ninipis yung hair nila, okay, magkakapatch. Sa ngayong panahon na to, diet. Marami kasi yung nagda-diet, crash diet, Cohen. Meron sa mga iniinom na medicines. Meron yung sa may problem sa loob ng katawan, may diabetes, meron mga hyperthyroidism, hypothyroidism, mga endocrine problems, kung minsan naglalagas din ng hair. Stress, nakaka-trigger din yan. Normally talaga yan, it's asymptomatic, so no symptoms at all, no itch, no pain. When there are some patients, ang complaint nila is parang may itching, parang sensitive yung scalp, parang konting hawak lang, parang may kuryente.
But certainly, being healthy and properly managing our locks is the road to stronger and healthier hair.
Healthy. Kumain ng kung pwede lahat ng food nutrients from the 3 basic food groups, kumain.
Feeling good starts from the top. That's why we will do anything and everything to maintain our hair's health, shine, and manageability. But what if we wake up one day and notice a change in our crowning glory? Is this a cause for alarm? In tonight's episode, we will discuss the most common hair problems, how to properly address these conditions, as well as tips on how to take better care of our scalp and hair. Joining us is Dr. Julieta Peralta Arambulo, dermatologist and hair transplant specialist from the Asian Hair Restoration Center and the Medical City. Also with us is Dr. Wilhelmina Asuncion Maniquis, dermatology consultant from the Asian Hospital and Medical Center and medical director of WAM Medical Spa. You can participate in the discussion by calling our hotline, following us on Twitter, on Facebook, and by emailing us. Now, let's start the discussion. Good evening, doctors. Welcome to the show.
Hi, good evening.
You know, hair is one of the most important parts of our appearance. There are good hair days and bad hair days. And then the bad turns into worse when we notice that there's more than usual or there are more than usual strands of hair on the bathroom floor, or maybe its texture has changed. What could be the cause of this? Dr. Arambulo, would you like to start?
Yeah, as mentioned earlier, there are many causes of hair loss problems. So it's important that a patient suffering from this problem would consult a physician specifically a dermatologist, because as dermatologists, we specialize on the skin, hair, and nails. It's important that they know the cause so that we can address the problem, because there are different causes and different treatments. No? So it's important also that as a physician, we have to see how, it's important that we know the history and the pattern of hair loss that the patient is suffering from.
Dr. Arbanikis, is there such a thing as normal hair loss?
Yes. It is normal for us to shed hair. That's about 50 to 100 hair strand a day. It's still within the normal limit.
And then when is it a cause for alarm? When do we have to go visit our dermatologist or hair specialist?
When it is more than 100 strands of hair a day, then it's about time that you see and check with your dermatologist.
Which leads us to the common hair problems that one will face in one's lifetime. What are the more common hair problems that an individual may face?
Okay, in my practice, we start with as a dermatologist, the clinical conditions we experience. These are the simple folliculitis, no? And then that's an infection, inflammation of the around the hair follicles.
What does that look like? What kind of?
It could start as a small papule, develop into a pustule, and then if neglected, it could develop into a severe type, which is boil or furuncles. Then if untreated, it will heal with scarring. So the patient would have patches of hair loss. And then also, of course, as a hair transplant specialist, I see lots of hair loss problems. The most common one is alopecia, which later probably we'll discuss. There are different types of alopecia. And then the genetic type, which is androgenic alopecia. And this is the permanent hair loss problem. And
Yes.
Dr. Arbanikis, yes?
Yeah, other problems encountered regarding hair. We have head loss or head lice.
Oh, yes,
which
this is
more
very common in children.
Among children, yes, especially in congested areas. Okay. So this is not really a medical problem. It's more of a cosmetic problem. So these louse are wingless. They don't fly.
Okay.
And,
They're nakakahawa ang head
yes, especially in congested areas wherein children get closer contact with each other. No? Okay, now aside from the head louse, then we have the dandruff or seborrheic dermatitis. No?
What could be the cause of dandruff?
If we go by the book, it says stress or tension can be one factor. And then the way you maintain hair hygiene is also one possible factor. You can develop allergy from certain products or ingredients within the shampoo or the conditioner or any hair product that you're using.
Can this also lead to the thinning of our hair when we use the wrong product or maybe stress?
Yes, definitely.
so if I may add,
Yes, please, doctor, go ahead.
actually, dandruff is dandruff. There's a mild dandruff, okay, and there are a severe type of dandruffs, and there are different conditions, okay. Simple dandruff, it's because it's a genetic, it's something that you inherited. There's something wrong with the epidermal turnover, okay. It's not normal. It's epidermal turnover. That's how we call it. It's fast. Instead of it goes after a month. Epidermal turnover happens like 2 or 7 days after. That's why the scales on the scalp you see are collected. No? So as Dr. Manike said, if you don't use the right shampoo, it will stay there. Now there are many conditions like seborrheic dermatitis. You don't just see the scales. You see redness, or that's how we call it, redness, plaques, erythematous plaques. That's
And about it being itchy, is that included in seborrheic
most patients
dermatitis?
would complain of itchiness also. And of course, many are familiar already with a condition called psoriasis. Okay, that's when you see thick scaling of the scalp.
You mentioned that using the wrong products may lead to these conditions. You also mentioned stress, and then now you mentioned
Yes,
it
definitely
could be
stress
hereditary
can,
as well.
yeah.
Yes.
So you really have to trace your background and check with your relatives or immediate family kung sino sa kanila yung who has suffered from something like this.
Yes.
Dadagdag ko lang, when you have stress, you develop tension in the skin of the scalp. So it can restrict the blood supply of the scalp and can contribute to the hair problem.
So a good sign, or not to say a good sign, but when we notice that something is wrong already, or that we notice a certain change in our scalp, then we can attribute it to either stress related, because our lifestyle now it's very fast, it's very hectic, you know, everyone's trying to meet deadlines, so talagang mas-stress tayong lahat, and it reflects na sa scalp natin or sa hair loss.
Stress is just one cause of hair loss, and it could lead. There are many conditions. You're right. There are many hair loss problems, different conditions, like alopecia areata could be stress related, but that's not the primary. That's not the primary cause. Okay, it could just aggravate the problem.
We will go back to the discussion on hair problems, and we'll be talking more about alopecia, but we have a tweet, doctors. We have a tweet from Anna Selena. She asks, I have mid-length hair and recently it has been getting really oily. What can I do to stop this from happening? So she has oily hair or oily scalp.
Sa scalp kasi natin, we have plenty of oil glands, no? So when we produce a lot of oil or sebum, then pwedeng ma-clog up ang pores natin, no? Leading to greasiness. So if you don't clean properly your scalp, then you'll have problem. It can contribute to hair loss also.
So, okay, I was about to ask, can oily hair lead to hair loss, or a dry scalp lead to hair loss?
Could be.
Could be. Yes, doctor. Yes.
It depends on the cause. No?
Okay.
If you have oily hair, you just have to shampoo that more often, because, as she said, the scalp is rich with sebaceous gland, no, oil glands. So if you don't shampoo if you don't shampoo your hair, so you'll develop
Oil accumulates and
Yeah.
may build up. Maybe we'll talk about how often we should shampoo our hair, but when we come back, we will get to know someone who has been living with alopecia. Medtalk will be right back here on the Solar News Channel. How often should
Hair helps to keep you warm.
It brings out your features pa. Thanks. I'm getting used to it na. Not being able to do this. Oh, sorry.
I was a little girl.
Ready na.
I had short hair. I put a towel over my head.
Okay. Out na.
Yeah.
Beautiful, thick, and healthy hair. This is how Jillian described her locks as a child. But the moment she turned 18, things changed.
Nag-start siya nung 18 years old ako. Nag-start siya ng 5 peso coin sa top ng head ko. Galing kami ng swimming noon. Then, napapansin ko, naglalaglagan na lang yung hair ko, bigla na lang siya naglaglagan. Tapos, yun na, nag-start na nagpatsi-patsi na yung, ano niya, yung ulo ko. Then, hanggat dumating na yung point na wala na, as in, pati kilay ko, dumamay na, pilik mata, lahat underarm, sa lahat ng may hair ako, lahat na wala na. Nag-first opinion kami sa doctor, then hindi ko nagustuhan yung suggestion niya. Then, nag-second opinion, dun niya sinabi na meron nga, diagnosed nga daw sa alopecia areata.
Jillian tried numerous treatments, hoping to get her once shiny and enviable hair back.
Unang reseta niya is, inumin ko siya for twice a day for 1 week. Kaya lang, nakakataba siya yung epekto ng gamot na yun is, magiging moon face nga daw. Yun yung una niyang pinatry. Yun, ipapahid siya sa hair twice a day din, morning and evening. Then, hindi na ako bumalik kasi hindi na ako natuwa dahil puro gano'n na lang, babalik ako, gano'n na lang yung sinasabi niya na more on diet daw, yung kinakain ko, more on yung masustansya, pero parang hindi rin naman nag-e-effect talaga. Doon ako nagsabi sa sarili ko na siguro stop na.
In the process, she learned to accept her condition and be proud of her appearance.
Doon yung point na ayoko nang pumasok. Sabi ko, hindi na ako papasok. Ayoko nang ganito. Ayoko nang pinagtitinginan ako. Ayoko nang pinagmubulungan ako. Tagal ko siyang tinago. More than 1 year. Nung siguro na ko rin na rin sa sarili ko na napapagod na ako. Siguro tama na magtago ako. Kasi hindi ko dati kahiya kung ano ako.
Today, a year after losing her hair, Jillian takes pride in knowing she's beautiful, with or without the security of her locks.
Sinanay ko na yung sarili ko na lalabas ako na walang wig. Sabi ko, kaya ko to. Sabi ko, kahit marami nakatingin dyan, hindi, maganda ka pa din.
We're back here on Medtalk, still talking about the causes and solutions to hair problems. Joining us tonight is singer, songwriter, and TV host, Abby Asistio.
Hello.
Hi,
Thanks for
Abby.
having me.
Welcome to the show. I love your look.
Thank you. I'm loving it too.
And I'm sure you get a lot of compliments about your look.
You don't really
Beautiful.
get compliments like you have a nice shaped head. So
Yes,
now
you do.
I'm getting it all the time.
But now you're used to it. How about before we went on the air, I was talking to you and you said you were diagnosed with alopecia when you were 4.
When I was 4, it started with patches, so coin-like bald spots. And then eventually the spots grew bigger and bigger, and then when they brought me to the doctor, they found out that it was alopecia. Yeah, and then initially it was areata, the spots lang, but then I started losing my eyebrows, my eyelashes, so different phases, because right now they're back, and I also have a little hair already in my head. So it's a process. I don't know when it's gonna come back, when it's gonna fall off again.
How did you feel? You were so young, like 4?
I know. I didn't know what was happening. I just knew that I was different from my classmates because I would go to school and wear hats. And of course, I didn't understand that there's this thing called alopecia. I just knew that I was bald. And I went through some difficult times when people, of course, would make fun of me simply because they didn't understand the situation of their classmate. But eventually, I learned how to cope with it. I started wearing wigs and bandanas and hats and got used to covering up my head. Yeah.
You had fun experimenting, so to speak.
Fun experimenting. It's
with the
medyo... there are times you have to be cautious about it. Like you can't just go out on the street, especially when it's windy, because you have to angle yourself so the wigs or the hats wouldn't fly off. Or you can't go swimming because you don't want your hair floating on the sea. So there are those concerns that, you know, even if you're coping with a disease, there's still a lot of limitations or inhibitions that you have because of it.
Yes.
Okay, so you're a pretty girl with alopecia.
Oh, thank you so much.
Okay,
Thank
I'm
you.
glad you accepted the condition because it's a recurrent, based on what you said, that's alopecia, no? And there are different types of alopecia. It would start as a patch, called that alopecia areata. And then if you get it earlier, as you said, she got it at age 4, so the prognosis is poor. So the chance of developing into alopecia totalis, meaning you lost all the scalp hair, and then she started also to lose the hairs from other parts of the body, the eyebrows, and eyelashes. So that is alopecia universalis already.
Yes.
The good news is you can grow back the hair, but in some cases, not 100%.
Yeah.
So I'm glad your eyebrows and your
Yeah, I'm glad
eyelashes
they're
are
back.
back.
They're back. But did it happen all at the same time? Like the eyebrows, eyelashes?
No, I lost my eyebrows and lashes when I was in grade school. So at first it was just totalis, so in my scalp, and then grade school to high school, they started falling out. But I think one thing that people should actually realize about alopecia is it isn't contagious. Because sometimes when you see someone's going bald, you feel like...
No, it's not.
Yeah, it's she has a life-threatening disease or something like that. Well, alopecia isn't contagious, and it's just the hair. But like what we saw in the video, it really affects one emotionally and
Yes,
mentally and
that's the-
psychologically. And I think that's the more than the physical disease. It's more of an internal battle for the people who have this condition.
You mentioned emotional and it's psychological as well. How about your family? How did they support you? How did they feel?
Yeah, my family was very supportive. Actually, when sometimes I would hear people make fun of me, I would just ignore them, but my family or my friends would be the ones to defend me, and they would always make me feel that I was loved and accepted, and I was normal in the sense of, you know, how other people look like, even if I didn't have hair. So they were very supportive.
So what treatments did you have already?
I tried a lot of treatments already. We even went abroad.
Oh, really?
I tried, because I had it 4 years old. Of course, my parents did everything from doctors to faith healers. We went to the albularyo. Sometimes nag-aalay sila ng chicken,
yes,
for my hair to grow back. But I tried minoxidil, the steroids, but I got allergic. So some parts of my head got burned.
Allergic to what?
I think I don't know, something in the chemical. But then when I was young, I would remember every night my mom would put aloe vera in my head. But it didn't work out. But I heard that there are different kinds of aloe vera, and then some are more potent. So I guess I just used the mild one.
So this happened during your childhood.
Yeah,
We'll
my
talk
childhood.
about how you're dealing in adulthood now that you're a singer, songwriter, and TV host. But before that, we have to go to our Facebook page.
Okay.
Diane Dizon asks, since having my second baby, I noticed my hair's condition changed. Now I have split ends, dry and unruly hair. Does this have anything to do with my pregnancy?
Yes,
Doctors.
it could be pregnancy related. Because during pregnancy, we have changes in hormonal levels. And then we have this phase right after childbirth wherein you lose more hair strands than the usual. And we call this telogen effluvium. No? So usually, ang napapansin ng bagong kapapanganak na female is, yun nga, nalulugas unti-unti ang buhok niya.
So
But
this
after
is
a while,
normal
it will
naman
come back.
kasi hormones are changing as well. So no cause
After a
for
while, it will come back.
Okay, and we will come back. More hair care concerns when we come back. You're watching Medtalk. Just a little bit. Pagbalik ka. Just a little. Kasi they're making us bye-bye na.
So, the now na lang.
The now. Yeah. And then just like maybe one tip each, Doc, before we close. See, ang bilis lang, diba? Patapos na. Dapat may part 2. Yes, sure. Yes, talk. We talk. We're back here on Medtalk. Abby, in adulthood, you have a very strong personality, very charming one, and I admire
you.
your strength.
Thank you so much. I'm like this whole process has been liberating because it was only last year that I decided to just shave everything off and
You do it
show
yourself?
people. Yes, I
Okay.
learned how to do it by myself,
Okay.
but sometimes I ask help from my mom in the back because I
Sweet.
couldn't see it. But it has been an amazing experience for me. Like even now going out, dealing with how people react. Like sometimes there are still people who whisper or laugh, but then you just learn how to give them a big smile and show them that I am comfortable the way I am, even with this condition. And I think that's what I really want to impart to others is regardless of how we look like or what disease or condition we have, you just have to be yourself and let your inner beauty shine.
Thank you. Bald is beautiful.
Bald is beautiful.
Thank you, Abby. Doctors, any last message to our viewers on how to take better care of their hair?
We should take care of our hair. It's our crowning glory, as Angel has said earlier. It's an expression of fashion. It could be a status symbol of your femininity or masculinity. So we better take care of it before it's too late.
Thank you, Dr. Armoniquez.
And then,
Dr.
as I said
Angelo.
earlier, you have to consult dermatologists because there are many hair loss problems and there are many treatments available now. There are medical treatments and surgical options also, especially in patients suffering from androgenic alopecia, a permanent hair loss problem. There's hope. Because hair transplantation is very successful.
And very much available here in the
Yes,
country.
definitely
Thank you
so.
once again, Dr. Arambulo, Dr. Armoniquez. Abby, thank you very
Thank
much.
you so much.
This is Angel Jacob for Medtalk. See you again next Tuesday, 10 p.m. on your scheduled on-air consultation here on the Solar News Channel. Good night.